So, now, ladies and gentlemen, it's time to welcome back Jens Nygren to the stage and hear his thoughts on how Halmstad University draws strength from all the different research environments and arenas to address healthcare challenges. So, Jens, please.
So, thank you. My name is Jens Nygren. I'm a professor in health innovation at Halmstad University. I'm also a profile manager of the health innovation profile of Halmstad University. And I'm going to talk a little bit about that, how we have worked through the last few years with profiling of research, education and collaboration towards health innovation. So it was decided upon in 2014 that to increase to make it clear how our university is positioning ourselves in the academic sector and also in society, and to make it clear how we are relevant to society as a university, that we should profile ourselves and use the strengths across the different schools at the university and the different subject areas within those schools, and to point out the direction and the direction that we want the university's research, education and collaboration to be characterized by, and to really be clear on how we bring value to society. So this was something that we started off in 2014. Health innovation was pointed out as one such profile area, and we already at that time point we started to figure out the challenge that we want to address with this profile area. So during these years, we have developed an understanding of the challenge that we as a university can address, and we talk about today that the challenge that we want to address with health innovation, research and education is the ongoing structural transformation of healthcare that is happening right now. And that includes the increased digitalization of welfare services, the medical and technological progress that enables individualized treatment, and of course the limitation of resources that we have in welfare sector, demographic changes and health trends in society that affects how we provide care today and will in the future, and the increased demands that we have in society for citizen influence and how people can be more involved in their health and healthcare. So when we want to approach this challenge, we know from experience and from research that innovations that affect organization and behaviors and processes are the most important for improvements in health systems. And these innovations, such innovations can be, for example, systems for outcome-based compensation, or transitions from a more emergency-focused care to more primary and preventive care. Or clinical processes that improves the safety of the patients or workflows within the health systems. And finally, innovations that improves involvement of patients in care, how they can be involved in decision making. These are all innovations that affects organization and workflows and how we behave within the health system. But we also know that it's very complicated to change such things as organization and workflows. To succeed with that, we need methodologies and tools to accelerate and facilitate such change. And such methodologies and tools often involves some sorts of technologies. And in our case, we have focused very much on the use of healthcare data, AI, and involvement of patients in introducing those into the methodologies and tools that we developed, that we want to develop. And at the same time, we also know that it's really difficult to introduce new ways of working, using technologies, integrating into methods. Implementing those in clinical practice is really difficult for many reasons. And this is hampering the success of such solutions, and it has also been pointed out as a barrier for success in the National Strategy for Life Science. So therefore, development of new digital solutions must go hand in hand with the development of strategies and methods for implementation and dissemination. So to really succeed with creating change through these technologies. So based on this, we have developed a way of describing the vision that we strive for, that we want to contribute to, and that is a more proactive and personalized care. That means care that is more accessible and personalized to the individual, that introduces new processes and patient flows within healthcare, that has improved use of resources to a high quality for the individual, and that uses health data for continuous development all the time and in real time. And that builds on new forms of health-related decision-making. So this is what we strive for, and when we try to, when we make decisions on what to do, we have this as a vision for what all the decisions that we make should bring about. And we are now, as I said before, we are structuring our profile at the university, including the strengths in the schools and all our 5 research environments, to gather profile research within 2 areas to work towards this vision. And that is research that is about AI technologies, systems and data infrastructure, and how to deal with sensitive data in legally and ethically safe manners, and how to integrate user experience in the IT systems that we build to create solutions for information-driven care. So this is one of the legs that we stand on, but we also, as I mentioned, we know that to improve healthcare, we also have to understand how to assess impact from many different perspectives, how to work with health economics as an argumentation for introducing new solutions, and also to assess the effect of those solutions, and how to work with implementing single solutions, but also continuous working with introducing solutions into complex systems to really make an improvement in those systems, and how to adopt long-term and diffuse solutions that are successful. So this is what we focus on research-wise, but we also understand that we cannot do this ourselves, and we saw that from the panel here before. We are not alone in this. We really need to collaborate with other parties within the municipalities, within the region, and with companies, and also with the citizens. And for that we have built up for many years now collaboration arenas at the university, of which I mentioned 3 here that are maybe the most important for this vision. And the arena that we call Leap for Life, that has had the name Health Technology Center Halland for many years now, but now, as you will hear later today, is now called Leap for Life, is a arena for collaboration that is focusing on development and introducing new solutions that can bring about information-driven care. Whereas the Health Lab is focusing more on improvement science and how to assess the impact, health and economics, to do clinical studies and facilitate introduction of new solutions and prepare organizations for that. And Fab Lab is an arena where we can fabricate, develop and test and co-create with the different stakeholders in the society. And also, really important, we need education to solve this, to work towards this vision. We need education on a high level, on a master's level, and on research level. And for that, we are developing now formats for that is optimized for our collaboration with external partners, so that people coming from companies or public sector can come to us and increase their competences, but not so that we can tailor and that we tailor these educational solutions to their needs and what is possible for them. But also we have a few really important projects that we have run throughout the last few years, where we have worked with increasing the competences within staff in the health sector to make them more prepared to introduce new digital solutions in their work life. The result of this profiling throughout these years has been that focusing on this vision and profiling and assembling research, education, and collaboration within this workflow towards this vision has resulted in that today approximately a quarter of the personnel within research and education at the university is focusing on health, on the health innovation profile. And approximately 1/3 of the external funding is spent on research within this area, and 1/3 of our total production of publications, research publications, is within this area, showing that we have a large portion of the focus of our work is towards this vision. So I will end up with a final slide showing the address to the web page where you can find our a form for signing up for our newsletter if you haven't already done so. So if you want to keep contact with us, get news, or being invited to events or educational offers or so on, you should follow our newsletter that we will send out several times a year from now on, to keep contact with you and to initiate and continue to collaborate with you together. So I will end up, and obviously during this day you will hear more about all the things that I mentioned in my slides here. You will hear more about concrete examples of this work. So with that I end.
Thank you so much, Jens.
Thank you.
Interesting to hear. Just out of curiosity, you and I are roughly the same age.
Roughly, yes.
So that means in the year 2055, we'll be approximately 80 years old.
Yes.
So you can do the math here. What do you envision in the healthcare system and services of 2055 will look like? What do you hope will be in place, and what do you think we can look forward to?
Well, I think it will happen. I think and I hope it will happen much sooner than that.
Because we're so young.
Yeah, but I really would like, and I envision that we healthcare and the health, how we deal with health in society happens in a much more collaborative way, where we don't necessarily separate between citizens and patients. We talk about maybe only people or citizens. The health system has changed in a way that we cannot really separate between those two, and that you don't. It's not when you, as a person, approach the health system to get help or support and become a patient. That borderline, I don't think we will have that. At least not the same way. It will change, and also that will also means that with the professionals, the professional roles will also change. Yeah. So they will be more collaborative as well, of course. Yeah. Everybody who has been working or within health systems know that there are hierarchies, and I think those hierarchies we will see a tremendous change there.
All right.
And that is both a hope and a wish, and I think it will happen.
Okay, so it's feasible. It's not only a wish.
No,
it is
I
feasible.
think it's happening.
Okay.
So.
Excellent. Well, that's really good to hear. Thank you so much, Jens.
Thank you.